Do you know that chronic kidney disease is a leading cause of death in the United States? Around 37 million US adults are estimated to be affected by it, and most of these are undiagnosed. Almost 40% of people with kidney problems don't even know they have them. They go on with their lives not knowing that a disaster is about to happen inside their bodies. Since kidney problems come with minor signs that might get ignored in the hustle and bustle of our busy schedules, it's not entirely their fault. But don't worry, we've got you covered. Today's video will help you get to know your kidneys better. We'll talk about their functions and, most importantly, the first signs of kidney disease so that you can seek timely medical intervention and prevent kidney damage. So, let's dive in. Let's first understand why kidneys are important. Your kidneys are just the size of a fist, but can filter all the blood in your body in merely 30 minutes. They remove waste, toxins, and extra water from your body to make urine. They're also responsible for maintaining a healthy balance of salts and minerals such as sodium, calcium, phosphorus, and potassium, which are essential for the smooth functioning of your body's nerves, muscles, and other tissues. Kidneys also release the hormones that regulate blood pressure, stimulate red blood cell production, and boost bone health. But what if they get damaged? Then you won't be able to filter blood as well as you should. Over time, toxins will build up in your body and interfere with the way other vital organs work. This may result in organ damage and have severe health repercussions, and there are fair chances you might end up in a hospital bed. Chronic kidney problems can increase the probability of infections. You tend to experience loss of appetite, depression, anemia, and mineral imbalances that might raise your blood pressure. Studies have shown that kidney problems usually progress slowly but worsen with time. They can also trigger early incidents of cardiovascular problems in affected individuals. Kidney disorders manifest in mysterious ways and remain undetected for most of the time. They are usually diagnosed with a bunch of specific blood and urine tests. However, here are a few subtle signs that you should look out for. The first and foremost common sign of kidney dysfunction is nocturia. Do you have to make frequent bathroom visits at night? If yes, then this excessive urination of nocturia could be a sign of underlying kidney problems. During the night, your body produces concentrated and fewer amounts of urine, which means you can sleep for 6 to 8 hours at a stretch without any interruptions. But if you urinate more than 3 times in the night, it can become stressful and require medical intervention. Diabetic nephropathy, or kidney damage caused by diabetes, can be the reason why you have to go to the bathroom so often. It's a serious complication of type 1 and type 2 diabetes that means your kidneys are getting worse. Diabetes may take 10 to 15 years to cause kidney disorders, but that doesn't mean you can ignore high blood sugar levels. Chronic hyperglycemia, or high blood glucose levels, will likely speed up organ dysfunction and trigger kidney issues well before their time. Now, the question is, how does diabetes lead to kidney disorders? Well, your kidneys are made up of a group of tiny blood vessels called glomeruli. This is where the process of filtration happens. Glomeruli are also referred to as the filtering units of your kidneys. Over time, having too much glucose in your blood can cause your body to make free radicals, or reactive oxygen species, which cause inflammation to your glomeruli and do a lot of damage to your kidney's filtering system. Because of this, the glomerular filtration rate is likely to drop in a very noticeable way. This also raises your blood pressure, which can further kidney dysfunction. Because your blood no longer has to pass through the strict scrutiny of kidneys, your urine becomes less concentrated, accumulates faster, and you feel the need to empty your bladder on a regular basis. Studies show that a common sign of diabetic nephropathy is urinating too much. Another common sign is proteinuria, which is when your urine has a lot of protein in it. Due to the high protein content, your urine can become frothy or foamy. An overactive bladder could also be caused by urinary tract infections, heart disease, sleep problems, depression, liver failure, being overweight, or having high blood pressure. Sometimes nocturia isn't a big deal. It could be a sign of a normal pregnancy, getting older, or drinking too much fluid right before bed. No specific medical attention is needed in the above cases, and the problem is likely to go away with a few lifestyle changes. Nocturia affects around 50 million people in the United States. Despite being so common, nocturia is widely underreported and left untreated for a long time, mainly to save oneself from embarrassment in front of the physician. An overactive bladder can take a heavy toll on your everyday routine. It can lead to sleep deprivation, which can meddle with your mood, drop your energy levels in the daytime, impair productivity at work, trigger cognitive decline, and increase your risks of falls and injuries at night. It can also cause indirect trouble for your partner's sleeping cycle. So if you feel that nocturia has been troubling you for a while now, it's time to see a doctor. We have also done a dedicated video on how to fix urination frequency at night, nocturia, for good. You can click on the link on the screen or check out the video linked at the end of this video. What are some other symptoms of kidney damage? Edema. It's swelling caused by too much fluid trapped in the body's tissues and is known to cause a pitting effect upon pressing. Studies have shown that kidney dysfunction often triggers a protein decline in your body because of the inability of your filtering units to pick up essential nutrients from your blood, as a result of which most of the proteins get excreted out in the form of urine. Protein tends to pull water into the blood vessels. If you don't get enough protein, fluid will build up in different parts of your body, causing edema. Edema can happen in any part of your body, but it occurs most commonly in the peripheries, such as the hands and legs. Long hours of standing or gravity are likely to make it worse. An effective way to deal with edema is to raise your legs or keep them on a higher platform, as in when you have time. You could also try compression stockings. Seek medical attention if the problem persists for a while. As kidney disease progresses, you may experience unexplained shortness of breath, excessive drowsiness, persistent nausea, confusion, pain or pressure in your chest, and seizures. What are some steps you can take to avoid kidney diseases? The simple answer to that is a few lifestyle modifications. Number 1, start by limiting your sugar intake. Since diabetes is a significant cause of kidney disorders, ensuring healthy blood glucose levels can help you avoid kidney issues. Number 2, lower your alcohol consumption. Increased alcohol intake puts undue pressure on your kidneys, and they have to work harder to process it. Alcohol can produce urine within 20 minutes. As a result, you will pee more often. This will trigger an electrolyte imbalance in your body and deplete your water reserves, further upsetting kidney function. Number 3, keep your blood pressure in check. Hypertension can narrow your blood vessels and restrict blood flow, so there will be a reduced oxygen supply to all vital organs in your body, including the kidneys. Also, high blood pressure can damage your blood vessels. Since the primary function of your kidneys is performed by a cluster of tiny blood vessels, or glomerulus, it becomes highly crucial to monitor your blood pressure regularly for improved kidney function. Number 4, cut back on salt. Studies have often linked high sodium intake with elevated blood pressure, an essential marker in kidney function, which is why cutting back on salt can help you prevent kidney damage. Since sodium is a popular ingredient in processed foods, it's better to avoid them and opt for healthy home-cooked meals instead. Number 5, exercise regularly. Nothing can beat the pros of staying fit. Working out relieves stress both mentally and physically. It improves your body's functioning and gives your kidneys a much-needed boost. Number 6, stay hydrated. To make sure you have the right amount of fluids in your body, you should drink enough water every day. This will solve all your health problems. Kidneys are vital for your overall health, so taking care of them should be your top priority. If you feel something is wrong with them, do not wait for the issue to grow. Seek timely medical intervention and root it out before it gets too late. Start with minor lifestyle changes and notice the results. Want to know about other vital organs in your body? Watch How to Fix Urination Frequency at Night, Nocturia, for Good. Or 7 Crucial Signs You're Not Drinking Enough Water. Go ahead, click on one. Or better yet, watch both. Did you notice any signs of kidney damage? Let us know in the comments below.